Welcome back. Right now we are going to focus on your health. It is estimated that over 100 million Americans struggle with chronic pain. It's a terrible disease. And I recently spoke with Dr. Michael Fishman all about ideas on what you can do to manage this condition. Let's take a look.
Chronic pain affects millions of American adults, and if you're one of them, the good news is that there have been advances in treatment that could help more people dealing with this debilitating condition. Here to explain and share the latest developments in patient care are Dr. Michael Fishman, a double board certified anesthesiologist and interventional pain medicine specialist at the Center for Interventional Pain and Spine, and his patient Genevieve. Thank you so much, both of you, for being here today.
Thanks for having us.
Thank you.
Dr. Fishman, how prevalent is back pain and what are the major causes?
You know, almost every adult human is going to experience an episode of back pain at some point in their life. Chronic back pain is when that doesn't just go away on its own, but stays with you for most days and forward for 3 months at least. When we start to think about what that means, 1 in 5 American adults are affected by chronic pain in some way, and that costs us over $600 billion a year. So it's a really challenging problem, and there's lots of underlying causes and effects.
Genevieve, what has been your experience with chronic back pain?
So Dr. Fishman says that anything beyond 3 months is considered chronic. I've had back pain for about 30 years. I had started with some numbness and then pain on one side. I wasn't able to sleep well. The pain would wake me up in the night. I was confined to sleeping on one side. I would wake up in the morning in pain and then have to kind of manage my day, determining whether it was going to get better or worse, or what did I need to do to keep it from getting worse, all kinds of different things like that. I had tried all kinds of therapies like chiropractic therapy, massage therapy, trigger injections, and over-the-counter medication, as well as prescription medication. Lots of doctors, lots of managing time, just to have it come back in the end anyway. It can be very defeating after all of that mental work and to have it just come back anyway.
Dr. Fishman, what advice can you give for managing chronic back pain?
You know, it's really important to understand the next path forward, and the only way to do that is to involve yourself with a physician or somebody who can help you navigate what you're feeling, when you're feeling it, and regardless of whether it's a problem that can be fixed or a problem that needs to be managed, they can help provide you the next path forward. So with Genevieve, you heard her story. She's been dealing with this pain for a very long time, and she ultimately came to me, and we, after looking at her past and looking at her pictures, started to discuss what the treatment options were for her. Now, she developed a problem that had no specific solution, and we were still able to treat her with something called DTM spinal cord stimulation. That's a new type of therapy developed by Medtronic, who we're here on behalf of today, that was able to provide her with relief and taking some of the obstacles away from her daily battle with chronic pain. Now, for Genevieve, this was a successful intervention and was the right path forward, but that doesn't mean it's a one-size-fits-all approach for everybody with back pain or anybody with any pain problem. So talking to your doctor and talking to a fellowship-trained, board-certified specialist to help you unpack that and consider your options is really critical.
Genevieve, how has this personalized treatment option helped you?
Most importantly, I'm sleeping better. I'm more rested in the mornings. That helps me prepare better for my day. I'm not taking over-the-counter, even the over-the-counter medication like I used to. Even that's not good for you long term. I'm not worried about doing things or where I'm going and what I might need to do to prepare for that. And I'm looking forward to being able to do normal things like going to the movies with my family where you have to sit for a long period of time, or even attending something like a concert at my son's school where you have to sit in those little auditorium seats. That was always very intimidating for me because I knew I was going to be very uncomfortable for that the whole time.
And Dr. Fishman, where can we go to find more information?
Yeah, I think the informed patient and the informed family member is really helpful. And to understand your options that we've discussed here today, you can go to medtronic.com/chronic pain to help prepare you to speak to your doctor about your specific case.
Well, Genevieve, thank you so much for telling us more about your experiences. I know you'll help many people. And Dr. Fishman, we appreciate this information that will really give a lot of hope to individuals that struggle with chronic back pain. We appreciate your time today.
Thank you.
Thank you so much.